Welcome to today's webinar. I'm Nick Bright, Partner and Director of Financial Planning in the Private Client Practice at Fiducient Advisors. We're thrilled to partner with Chapter to bring you valuable insights for making informed Medicare decisions. At Fiducient Advisors, we understand that planning for retirement involves much more than just Medicare. It encompasses a comprehensive approach to managing your wealth and securing your financial future. For those of you who are nearing retirement or who have recently embarked on this exciting journey, we want to briefly introduce you to our private client practice. Our team specializes in providing tailored wealth management solutions designed to meet the unique needs of high net worth individuals and families. And for those of you who oversee the HR efforts at your firm, we want you to know that our private client practice can also help your employees meet their retirement goals. Whether it's optimizing your investment strategy, planning for estate and tax considerations, or ensuring your financial goals align with your retirement plans, we're here to offer personalized guidance and support. If you have any questions or would like to learn more about how we can help you achieve your financial goals, please don't hesitate to reach out to us. We're excited to be joined today by Ari Parker, the co-founder and head of Medicare Advisory at Chapter. Ari holds a JD from Stanford Law School and is the best-selling author of It's Not That Complicated. Ari's approach to Medicare planning has been featured in the New York Times, the Wall Street Journal, and Forbes. In today's presentation, Ari will cover the basics of Medicare along with some thorny complications that may come up along the way. Ari will also cover what sets Chapter apart in the Medicare space, with Chapter's education-first approach and ability to search across 24,000 Medicare plans nationwide to find an ideal Medicare plan based on an individual's needs. Ari, thank you for joining us today and for sharing insights on a very important matter as it pertains to retirement planning.
Thank you so much, Nick, for inviting me to speak, and thank you to Fiducient for hosting. So let's talk about our agenda for today. First, I'm going to cover the key parts of Medicare. Then I'm going to talk about the 7 Medicare mistakes to avoid, and you will avoid them if you work with Chapter, and we'll talk about how you can set up a one-on-one consult with our team a little later on. And then finally, I'll discuss how to take action in advance of the Medicare annual enrollment period, which is right around the corner in 4 weeks. So first things first, if you'd like a copy of It's Not That Complicated, we'd be happy to offer you a digital complimentary copy. It's a bestseller on Amazon. You can scan the QR code. If you'd like a one-on-one appointment with our team, you can go to askchapter.org/partners/fiducient, or just by scanning that QR code, it will also offer you a one-on-one consult if you'd like. So let's talk about the key components of Medicare. And I want you to picture this as a 3-legged bar stool. You need all 3 legs in order to have comprehensive coverage. The first leg of the bar stool is hospital coverage. The second leg is everything outside the hospital, that is outpatient coverage. And then the final leg of the stool is drug coverage. We're going to be talking about all 3 legs during the course of the presentation. Now, the first 2 legs of the stool, hospital and outpatient, are referred to as Medicare Part A and Part B. You might also hear it called Original Medicare. Original Medicare is Part A and Part B. That comes directly from the government. So let's break these down further. Part A is hospital insurance. This covers you when you're inpatient, when you're in skilled nursing facility care, when you're receiving home health care, but it's very limited on the home health care front. And it also covers hospice care. It means you have a wristband. If you don't have a wristband, then you're actually being held for observation. Medicare doesn't cover observation. So if you go to the hospital, make sure that you get a wristband. And if you do, then it's going to be covered under Part A. Now, Part A has no monthly charge as long as you or your spouse have worked 10 plus years and paid federal payroll tax. This applies to almost everyone, if not everyone, on the call. So the only thing is you need to pay federal payroll tax for 10 plus years, or your spouse does. If you meet that criteria, then you have paid the premium for Part A. It's premium free. With that said, there is a deductible. It's over $1,600 per hospitalization, and we'll talk about how to cover that deductible a little later on. Then there's Medicare Part B. Part B is everything outside the hospital. This is also referred to as outpatient coverage. This covers visits to the doctor, visits to specialists. It also covers lab work, x-rays, MRIs, CT scans. I know there were questions about how to get lab work covered. Guess what? Lab work is covered under Medicare Part B. And it also covers preventative services, including an annual wellness checkup, which is very similar to a physical. Now, there's a charge for Part B. For most Americans, It's $175 per month, approximately $175 per month. For 2025, the cost will likely go up to approximately $185 per month, but the final figures haven't been published yet. They will be released early next month. Now, if you and your spouse are both on Medicare, then each of you owes the premium for Part B. There's no family plan. So you would owe approximately $175 and your spouse would owe approximately $175. There's one more thing I'll mention here, and I'm going to cover it under the 7 Medicare mistakes to avoid. If you're a high earner, then you owe more for Medicare Part B. And I'm going to talk about the high earner surcharges a little later on. What many don't know is that they're appealable, and we help fiduciant clients all the time appeal their IRMA, that is their income-related monthly adjustment amount. So that Part A, Part B equals original Medicare. That's the first 2 legs of the stool. This is a picture of your red, white, and blue card. It comes directly from Uncle Sam. And you'll notice right there is printed your Part A and your Part B date. Now, if you're starting Medicare by way of turning 65, then your Part A and your Part B date will match. If you're coming off yours or your spouse's work-provided coverage and you're beyond age 65, then it's common for your Part B date to be after your Part A date. Or perhaps you just have a card that says Part A only. That means that you have other coverage for your health insurance and you haven't activated your Medicare Part B yet. We'll talk about how to activate that a little later on in the presentation. A fun fact, I'm a huge Medicare nerd. The first recipient of a red, white, and blue card was actually former President Harry Truman and his wife. They were the first 2 red, white, and blue card holders. You're going to hear a lot about Medicare as the election approaches. It was already a big subject of the debate last week. Medicare is extremely popular. It might be the most popular government program next to Social Security. I don't think the government has any plans to touch it. If anything, there have been proposals to expand it. Now, let's talk about 2 big ticket items that original Medicare doesn't cover. The first is that there's no financial limit on your out-of-pocket exposure. My mom, I'm from Northbrook, Illinois, actually. I went to Glenbrook North High School. That's where I grew up. My mom lives in the Chicagoland area still, and she needed a knee replacement. Her replacement at Rush cost $40,000. Had she not had any type of out-of-pocket coverage, she would have owed $8,000 for her knee, plus all the pre- and post-op work. Then, a month later, she slipped and broke her elbow. She's bionic at this point and can't go through a metal detector. She would have owed 20% for everything related to the elbow as well. So had my mom not had some type of additional coverage, she would have been exposed to well over $10,000 in medical costs last year. The second big ticket item that original Medicare doesn't cover is long-term care. Long-term care is defined by the activities of daily living, such as eating, bathing, dressing, toileting, even cognitive decline is considered part of long-term care. There's no coverage under original Medicare for long-term care insurance. There have been proposals to add it to Medicare, but it would simply bankrupt the country. It's too expensive to insure. So the best time to have a conversation around long-term care insurance is in your late 40s or 50s. By the time you get to your mid-60s, the cost of insurance is typically too high. You might also hear long-term care insurance referred to as nursing care, around-the-clock care, 24/7 care. Those are all, or custodial care. Those are all synonymous terms for long-term care insurance. There's no coverage under original Medicare for long-term care. So now I want to transition to the top 7 Medicare misconceptions, 7 Medicare mistakes that you can avoid. And just by virtue of attending this presentation, I think you're in a great position in order to avoid them. The first mistake people make is that they assume Medicare begins automatically when you turn 65. This is only true for someone who's taking Social Security. If you're not taking Social Security, and most of you are waiting until full retirement age or until you hit age 70, then your Medicare is not automatic. Instead, you're going to have a 7-month initial enrollment period when you turn 65, and that period begins 3 months before your 65th birthday, and it extends to your birth month and 3 months after your 65th birthday, the month in which you turn 65. So it's a 7-month initial enrollment period in total. So for example, if Nick were turning 65 on December 23rd, then the earliest that Nick could have signed up for Medicare would have been September 1st. And as long as Nick signs up for Medicare in September, October, or November, then his Medicare Part A and Part B will start December 1st. It always dates to the first of the month. But let's say Nick waits until December in order to sign up for Medicare. Then his Part B won't start until January. He'll be uninsured for the month of December. So it's really important that if you're retired, if you're on COBRA, if you're self-employed or work for a small employer, which means 19 employees or fewer, that you sign up for Medicare by way of turning 65. And the best time to do it is 3 months in advance. This is something that takes less than 5 minutes to do online. Don't call the Social Security Administration. You're going to wait on hold for over an hour, and they won't help you sign up for Medicare. Instead, use your online Social Security account portal in order to activate your Medicare. And if you need our simple one-page instructions on signing up for Medicare, you can email us at fiducient@askchapter.com. fiducient@askchapter.com. Now, let's talk about if you wait to sign up for Medicare. What if you're past age 65? Well, it's okay to wait if you're past age 65 in order to sign up for Medicare, as long as you or your spouse work for an employer with 20 or more employees. The critical number is 20. If you or your spouse work for an employer with 20 or more employees, then you can remain on that insurance until retirement. With that said, Medicare might be a better deal than your work-provided coverage, and we'd be happy to do an apples-to-apples comparison for you and see which one is optimal. When you're ready to retire, when you or your spouse are ready to retire, then you will receive a special enrollment period to activate your Medicare Part B. If you work for an employer with 20 or more employees, there'll just be a one-page form for your health benefit coordinator to fill out or a company official. And then you submit that form to the Social Security Administration, and they help you activate your Part B. You can even do it online using our easy-to-follow instructions. Now, for those who are past age 65 and you're waiting to activate your Medicare Part B by way of special enrollment rather than by way of turning 65, then you will receive an 8-month window in order to activate your Medicare. However, it's important not to wait, because if you wait, let's say you wait all 8 months, then you're uninsured for that 8-month period in which you waited. You might say, well, I'm planning to remain on COBRA. Guess what? COBRA isn't creditable for the purpose of delaying Medicare. COBRA is only secondary to Medicare. So it's very important, even if you plan to use your COBRA, COBRA is secondary to Medicare. You still need to activate your Medicare in order for your COBRA to apply. We see people screw this up all the time. It's a key mistake that we help people avoid. COBRA is not primary insurance. Medicare is designed to be primary. COBRA is secondary. And COBRA is very expensive. So unless your company is offering to contribute to your COBRA premium, it's probably a better deal for you to sign up for additional coverage through Medicare, like a Medigap plan, which we'll talk about a little later on. Now, there's an important exception here. If you're contributing to a health savings account and you plan to continue making active contributions to that HSA, and HSAs are amazing. I contribute to one here at Chapter. They're triple tax advantage. However, they are incompatible with starting any part of Medicare. When you start Medicare, you must discontinue contributions to your HSA. You'll still be able to use all the contributions towards any qualified medical expense. So you can still use all the savings you've accumulated, but you can't make any fresh contributions. And if you need any help on timing when to stop your HSA contributions, please feel free to reach out. It's the most technical rule that the Social Security Administration has on the books. The long and short of it is, here's a simple heuristic you can use. If you're contributing to an HSA and you're planning to enroll in Medicare by way of turning 65, then you need to discontinue contributions to your HSA the month before you turn 65. If you're past age 65, then you need to discontinue contributions 6 months before you intend to apply for Medicare. You must discontinue contributions 6 months before you intend to apply for Medicare if you're past age 65. The reason why is because the government is going to backdate your Medicare Part A by 6 months, and you can't have your Part A coincide with making contributions to your HSA. You must have discontinued making contributions prior to your Medicare Part A starting. I'm sure we'll get a lot of questions on this. It's a fun one. All right, let's talk about the second misconception. It doesn't matter when you sign up for Medicare. You know that this isn't true. There are penalties for late enrollment. If you delay signing up for Medicare Part B, there's a 10% penalty for every year in which you should have signed up but waited. So, in fact, earlier today, my team was counseling a 69-year-old who should have signed up when they turned 65, but they waited 4 years, so they owe a 40% penalty on top of their Part B. So it just gets worse the longer that you wait to sign up. If that person had waited 11 years, then they would have owed 110% penalty. The same is true on the Part D side, but the timing is even worse. If you don't sign up for prescription coverage within 63 days of having stopped your work-provided coverage, then you will owe a 1% penalty for every month in which you should have signed up. So if you're on work-provided coverage, then it probably offers creditable Part D coverage. Creditable Part D coverage just means drug coverage at least as good as what you would have received from the government. However, if you're not receiving coverage at least as good as what Medicare Part D would offer, then you have to sign up for Part D, or else you'll face a late enrollment penalty for Part D as well. It compounds and it's a lifetime penalty. So just wanted to put that here. If you sign up timely, just by virtue of attending this presentation, I think you're going to be in good shape for avoiding the penalties for late enrollment. But I just wanted to note that here because there are penalties if you delay signing up for Medicare when you should have taken action. The third misconception about Medicare is that there's nothing you can do about the Medicare high earner tax. Remember when I was saying that most people pay approximately $175 for their Medicare Part B? Well, if you're a high earner, then you're going to pay more. And if you'd like this one-page fact sheet, then you can email us at fiducient@askchapter.com, and we'd be more than happy to share it with you. So who does the income-related monthly adjustment amount apply to? The government calls this IRMA. IRMA is the high earner tax on Part B and Part D. It applies to anyone who earns more than $103,000 and files solo based on their MAGI, or someone who earns more than $206,000 and files jointly based on their MAGI. Now, what tax year is the government looking at? The government is looking at your tax return from 2 years ago. So for this year, the government is looking at your 22 tax return. And for next year, the government will be looking at your 2023 tax return. But what many people don't realize is that if you've had a change in your life circumstance, then you can appeal your IRMA. So the two most common reasons for appealing are work reduction or work stoppage. And the third most common reason, unfortunately, is divorce. But having a really good year in the tax in the market doesn't count as a reason to appeal your IRMA. Instead, it will automatically adjust the following year. But do know if you've had a change in life circumstance like a work reduction, a work stoppage, you can appeal your IRMA. It's something we help dozens of clients with per day. The fourth misconception is that Original Medicare covers all of your costs. You know that this isn't true based on my mom's story. Original Medicare only covers 80% of your medical costs. You owe the other 20% out of pocket, and there's no cap on your downside exposure. So the big question is, how will you cover the 20% of medical costs that Original Medicare doesn't cover? What's more is, Medicare Part D is separate from Original Medicare. Though it's technically voluntary, it must be purchased through a private insurance company. And what's more, Original Medicare doesn't cover services like dental, vision, and hearing. So when people realize that there are these gaps under their Original Medicare, it's what prompts them to reach out to an independent, unbiased advisor like Chapter, where we search every insurance company and every plan nationwide. We search all 24,000 plans available to you. So there are two ways to achieve comprehensive coverage. Option one, which candidly is the option that most of you will likely prefer. Option one is to keep Original Medicare and add a Medicare supplement plan, which is also known as Medigap. And I'm going to talk about this more in the next slide. If you go this route, then the only thing you need to add is a standalone prescription drug coverage, a standalone Part D plan. So option one is Medigap. It covers the gap that Original Medicare doesn't cover. That is the 20%. And then you would add a standalone prescription drug plan. Option two is what you see advertised on television. Option two, you could pick your favorite ex-NFL quarterback talking about these plans. Joe Namath, Fran Tarkenton, they're talking about Medicare Advantage plans. This is also known as an all-in-one plan or a Part C plan. And what these plans do is they replace Original Medicare through a private insurance company. So it's subject to managed care. And this is where we get into the world of HMO or PPO-like restrictions. So it's subject to waiting periods. It's subject to prior authorization. It's it has limitations on the way that you can use your coverage. And you still owe your Part B premium to Uncle Sam. So while these plans oftentimes have a premium as low as $0, you still owe your Part B premium to the government. Now, what people like about these plans is that it's all in one coverage. It oftentimes comes with prescription drug benefit, with dental, vision, and hearing. What people like a lot less, though, is it restricts the way that you can use your hospital and medical coverage, unlike option one. So option one is going to work better for most of you. So let's talk about why fiduciant clients tend to choose Medigap. The first reason is they appreciate not having to worry about whether their doctor is in or out of network. Original Medicare is networkless. You can come to Arizona and see a doctor at the Mayo Clinic. You have the freedom to see any specialist you want nationwide without a referral, as long as they're accepting new patients. So Mayo Clinic, Cleveland Clinic, MD Anderson in Houston, which is probably the nation's leading cancer research institute, UCLA in California, Sloan Kettering in New York, you name it. You can go to those institutions. They all accept Original Medicare. They don't work with Medicare Advantage. Another reason that fiduciant clients tend to prefer Medigap is they appreciate not having to deal with bills or copays. The only question is whether you've met your Part B annual deductible for the year. Mine here at Chapter, my deductible is $6,000. Your deductible under Medicare Part B is $240. It's a bargain, and I can't wait to be Medicare eligible to get a $240 annual deductible. Once you hit that deductible under a Medigap plan, you won't see another Medicare-approved expense thereafter. And then the final thing is Medigap is designed to last a lifetime. Your benefits don't change year over year. So the way that I train our team here at Chapter is marry your Medigap, date your drug plan. The Medigap plan that you sign up for when you first turn 65 or when you first start Medicare is probably the plan that you're going to have the rest of your life. But every year, we'll review your drug coverage in order to unlock further savings. And that's our commitment to you. We provide ongoing year-round concierge support. So in the state of Illinois, and many of you are located in Illinois, but this is also true in 45 other states, there is a one-time opportunity to get Medigap. And if you're outside that 6-month Medigap open enrollment period, then you are time restricted as to when you are, you are subject to underwriting. You are subject to questions about your health history. But if you act during your Medigap open enrollment period, which is the 6 months when you start Medicare, whether it's by way of turning 65 or perhaps you're past age 65 and signing up, having left work-provided coverage, you can get Medigap without any questions about your health history. But outside of that 6-month window in Illinois and 45 other states, you are subject to underwriting. You are subject to the carrier's health questions unless a guaranteed issue right applies, which are few and far between. So I'm happy to go into that more. The 4 states that are the exception are New York, Connecticut, Massachusetts, and Maine. So they're all along the northern Atlantic seaboard. So let's talk a little bit more about Plan G. Plan G is a specific type of Medigap plan. Each plan letter type is standardized under federal law. So Plan G works the same in Illinois as it does in New York, as it does in Arizona. What it allows you to do is it means you don't have any network restrictions on your coverage. There's no referral required for specialist visits. There's no additional bills or copays once you've met your $240 Part B deductible. It works nationwide. If you live in Chicago but winter in Florida or Arizona, there's no issue getting coverage in those states. And it includes 80% international coverage when you travel abroad. So the New York Times picked up a story about Chapter last year. We had a client who was vacationing in France and they needed to be hospitalized outside Paris because they suffered a heart condition and they racked up $30,000 in hospital bills. Because they had a Plan G, our team was able to help that client get $24,000 reimbursed, so it didn't ruin their trip. So don't overlook that 80% international coverage benefit if you're a travel bird. Now, it is subject to a $50,000 lifetime limit, that the international coverage benefit, but $50,000 goes a long way in other places. And even in Western Europe, it didn't ruin the client's vacation. Now, let's talk about option 2 in a little more detail. Option 2 is Medicare Advantage. Remember, this is a replacement for Original Medicare administered by a private insurance company, and it's subject to managed care restrictions. So here we get into the world of prior authorization, waiting periods, and limitations on how you can use your coverage, network restrictions. So candidly, it's not going to work very well for many of you. Now, even if you're healthy, it could work okay if you're healthy, but you want to think about how your health will evolve because you're making a long-term purchasing decision. And many of you, actuarial tables suggest that many of the attendees in this presentation will actually live to be 100. So you remember, once you start Medicare, you're making a 30 to 35 year decision. So you don't want to pass up your opportunity to sign up for your in your Medigap open enrollment period, because your Medigap open enrollment period is the 6 months after you activate your Medicare. Now, there is no health history questions about Medicare Advantage, and the time to review your Medicare Advantage plan, if you're on it, is from October 15th to December 7th. So the fifth misconception is choosing drug coverage isn't important if you don't take expensive prescriptions. You know that even if you don't take expensive prescriptions, even if you don't take any prescriptions at all, there is still a late enrollment penalty if you forego Part D coverage. So the reason it's important to get Part D is to avoid lifetime penalties and to make sure you have prescription insurance in case you need a prescription during the course of the year. There's two ways to get it. If you go the Medigap route, then you would add a standalone Part D prescription plan a la carte. If you go option 2, then it would be important to make sure that your Medicare Advantage plan includes prescription drug coverage, and the vast majority do. So there's two ways to get Medicare Part D. The sixth misconception is that your neighbor's plan is a good choice. Now, you know your neighbor doesn't see the same doctors as you. They probably don't take the same prescriptions as you do. You probably have different life priorities. As much as you love your neighbor, you probably have different life priorities than them. So here at Chapter, in a one-on-one consultation with our team, we'll discuss your 3 Ps, and I write about this in the book. Your 3 Ps are your providers, who are the doctors that you want to see. We want to make sure that if you go option 1, that they all accept original Medicare. If you go option 2, that they would be in the network of your choosing. The second P we'll discuss are your prescriptions. And on average, we save clients $1,100 per year just by taking 15 minutes to review their prescriptions during the annual enrollment period. And then the final P that we'll discuss are your priorities. What's important to you? Do you have a second home? Do you have a grandchild on the way? Are you planning to travel internationally? All of that will factor in to finding the right plan for you. Even in a couple, you can see each partner make different decisions. So it's important to do this one-on-one. Even in a couple, we can see that they might choose different plans than each other because perhaps their 3 Ps are different. And then the final misconception is you only need to choose your coverage once. So if you go the Medigap route, then you need to review your drug coverage every year. If you go Medicare Advantage, then it's important to review your coverage every year as well, because what changes about your Medicare Advantage plan are the premium and costs, the benefits associated with the plan, and the networks. The networks under a Medicare Advantage plan can even change mid-year. So this is something an independent, unbiased advisor can really help with. You want to work with someone who has access to every single insurance company and every plan nationwide in order to make the most of your coverage. If you have any questions, you can email fiducient@askchapter.com. And now, Nick, would you like to go over some of the FAQs that came in?
Yeah, that'd be great, Ari. Excellent presentation. A lot of great feedback just from what I'm seeing in the chat box here. So thank you for today's presentation. A number of questions relating to keeping your insurance through your employer past age 65. You noted the 20+ employee requirement. There were some questions, again, just regarding the HSA rules. One of the questions that specifically came up is, what if I'm on my spouse's insurance and my spouse is still making HSA contributions? Does that complicate their ability for signing up for Medicare?
So if your spouse is contributing to an HSA, that is fine as long as they haven't started any part of Medicare. You can also contribute to that HSA as long as you haven't started any part of Medicare.
Okay, great.
Remember, it is incompatible to take any part of Medicare and make contributions to an HSA. You can still use all the savings accumulated, but you cannot make fresh contributions. Otherwise, you'll have to refile your taxes, claw back the contribution, or face a federal excise penalty. It's really a pain.
Okay. Are there other considerations individuals should be keeping in mind when they're weighing Medicare versus keeping their employer insurance? Obviously we're speaking from a high level perspective, but what things come to mind, Murray?
Great question. So let's break down how we think about an apples to apples comparison between your work provided coverage and what you would receive if you were to start Medicare. The first question is who your employer coverage insures. If it's insuring you and a spouse who's under the age of 65 or a dependent, then you probably need to keep that work provided coverage, because what would they do if you were to transition off of it? So if it insures more than you, I would recommend keeping that work provided coverage unless it's very expensive. Now, if you're the only person who the work provided coverage insures, or if your spouse would also have the option of transitioning to Medicare, then the next question is how much you pay. What's deducted from your paycheck to keep that insurance? For the employee, it's usually subsidized by the employer. But for your spouse, that's oftentimes not the case. So it's a bad deal for your spouse, and your spouse might benefit by transitioning to Medicare. And then the third question is, how much do you like your work coverage? Are you happy with it, or is it very limited? If it's very limited, then Medicare, because there's no network restrictions under original Medicare, might be a better deal. And also, I know that there are some questions about the cost for Medigap insurance. It's not very expensive in Illinois, shockingly. Illinois is expensive in a lot of areas, but Medigap insurance isn't one of them. It's quite a reasonably priced Medigap insurance market. So Plan G wouldn't break the bank.
Okay. And then one final question here. In the chat, I'm seeing just with regard to late penalties for signing up for Medicare. Presumably that is an exception if you're keeping your employer-based insurance because you're still actively employed and you still have the opportunity to sign up for Medicare once you've ceased to have that work coverage.
Yeah, you don't exactly. If you work for an employer with 20 or more employees, then your insurance is 99% of the time considered creditable for the purpose of delaying Medicare, and you don't need to do anything.
Perfect.
And
Well,
your HR department would actually be required to tell you if you do need to do something.
okay. Excellent. Well, again, Ari, really appreciate the insights and time today. Excellent presentation. Individuals should really continue to look at Fiducient Advisors as well as Chapter as a helpful resource. So as you're on your retirement journey, please feel free to reach out to either firm as it relates to either Medicare planning or broader-based retirement planning. And you'll see that link at the very bottom, askchapter.org/partners/fiducient, to the extent you'd like to go to the website just to learn a little bit more about how Chapter can help you for Medicare planning. Thanks everyone for your time today on today's presentation. Thanks, Ari.
Thank you so much for having me.